get through? Sorry, guys.
The purpose of the breath meal program, the CHALK breath meal program, under my directorship, has been threefold. One is to deliver expert asthma care to underserved children living in our community. I might point out there are about 10 or 12 programs like ours around the country. The second thing that we've developed is a very strong teaching vehicle for medical residents, pediatric residents, nurses and other healthcare professionals. And thirdly, this is an excellent floating laboratory to carry out research that will add and improve the care of the asthmatic child. So I think it's all three in one, and we've been doing it for about 11, 12 years, and it's been extremely productive. I'm very proud of my staff. I think it's a great program, and I'm just happy to be part of it.
Where did you get the idea for it?
The program developed in 1995 in Los Angeles under the directorship of Dr. Craig Jones, working at USC LA County Hospital, and he developed the first model. And I was at a medical meeting a few years later where he was showing all this tremendous data, and I said, this is something I want to bring to Orange County. So I brought it to Orange County in 2002. So this is our 11th year. I might also add one other thing, that we have an asthma Olympics. It's called the Air Power Games. And every spring we invite a bunch of children to participate in Olympic athletic events at Santa Ana College. And we've been tremendously successful. The purpose is to show children that they should and can exercise and be athletic Olympic athletes. Secondly, we have classrooms right near the field where we give them and their families great education about asthma. And thirdly, they're at a college, which should inspire them to someday their children can go to college as well.
For a checkup, he has asthma, and then I bring him, every 2-3 months for a follow-up and to see how he's doing, and then, if he needs any more medications or any other, to see how he's progressing.
So you've been to this breathmobile before, huh?
Yeah, well, not me, but my wife is the one who's been here the most. I mean, this is my second time.
Can you give us an introduction to what this is, insofar as you know about it?
This is a mobile breathmobile, which is I think every certain times they go to different places for very convenience for the people to to get closer to the place so they can get their son treated, or relatives. In this case, it's my son. So anywhere they are, if we can make it to these mobile devices, if they have anywhere else, we'll go meet them there. So this is pretty convenient because, like I say, if I can't make it to the hospital or they don't have any openings, they come to my neighborhood and I can just come down and visit them. So.
Well, why do you think something like this is important to have?
Well, asthma is a really, I think it's a really serious medical condition, and then if we don't look for the resources, I mean, it can get complicated, and I gotta make sure my son gets get treated, constantly before get any worse, so, and to have the the medications that I need for him. So.
How did you guys find out that your son had asthma?
Through one day he got sick. It was not like a regular cold. It was not like a regular disease, like a regular flu. He was coughing differently, and then he was doing different noises. So we took him to his doctor, and that's when they determined that he has asthma. And then since we have a little bit of asthma history in our families, because my eldest is the same, so we bring him too, off and on. So that's the doctor, discovered that he has asthma too as well.
So what will they do in there so far as the checkup goes?
What are they doing? They check his lungs. They check to see how he's breathing. They check to see if he any whistling in his chest. They checking that we make sure that he's taking the right medications, that we're following up the procedures, that he's up to date with his vaccines. So they try to keep us up to date too. Whatever's up there now for us. Every time there's usually the same doctor, but they keep their medical record pretty accurate. So I mean it's pretty convenient for via mobile clinic.
Okay, cool. All right, thanks.
Okay, so basically our goal today at the Breathmobile, we saw about 10 patients. We see them to kind of help educate about what asthma is, and that way they're able to understand why they need certain medications to help prevent and control their asthma. Because usually when they go to a primary doctor, they get the diagnosis of asthma, but they don't really know what that means, or they have so many questions that sometimes are not answered while they see their primary pediatrician. So here we're able to spend more time in educating them and providing more information, and we also follow up with them closer, so that way we can see how their asthma has been doing, compared to a month ago when they were not on any medications to how they are now. Now their symptoms are so much more improved, and just taking that time to explain and educate them makes a huge difference in how they treat and manage their asthma. And so basically that's our goal of the Breathmobile, is to help manage their asthma.
What type of patients, what type of cases did you see today?
Today I saw some returning patients that have improved. Other ones still, not much changed, but I don't know what to say about that. I have one that has not been on his medication, and based on his testing, definitely needs to be on medication. So we, emphasize the importance of the difference that the test would show if he were on medication.
What is the demographic mainly of the patients that you would see on this?
Hispanic, lower income, lower resources, mostly Spanish speaking. And since I speak Spanish, I'm able to, answer their questions in regards to their medication.
And how do you feel the Breathmobile helps them?
Because we have a nurse that speaks Spanish and able to answer their questions, because I speak Spanish, and we're just taking more time and providing education.
No, it's perfect.
Can you say that comment again, but say
I'm getting hot.
the Breathmobile helps because of...
Oh, okay. The Breathmobile helps because we're able to provide more education in regards to what asthma is, and that way they're able to prevent and manage their asthma symptoms better than they were before, without knowing all that information that we're able to provide them with at the visits.
My name's Brenda.
Okay.
That's good.
Sorry. I was not prepared for this.
So how many patients do you typically see?
We're trying to see more patients now, but on the average we see about 10 patients. But our goal is to see at least 15 patients a day. So we see about 7 in the morning and like 6 or 7 in the afternoon.
Okay, thanks.
You're welcome.